Meeting will come to order. I'd like to welcome everyone to the May the 18th meeting of the Castle County Board of Commissioners. If you would, join me in a moment of silent prayer, followed by the Pledge of Allegiance. Amen. Pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all. Public comments.
We do not have any tonight.
All right. Recognitions. I'll start with you, Commissioner Claggett.
I have none.
All right, Commissioner Ingram,
None, sir.
Commissioner Rose.
Thank you, Mr. Chairman. Real quick, and this may seem like a strange recognition, but Sunday morning, we had a motor vehicle accident out on 86 North, and in the course of that vehicle accident, the family had a pet in that vehicle that wound up jumping from the car. There's a lot of people know some people have pets that are dogs and cats, and some people have dogs and cats that are family members. I want to give a shout out to the volunteers with the fire department of Yanceville. They went over and beyond. They actually searched the woods trying to locate him. Were not able to locate him that day, went back the next day and actually located him about a half a mile from where the accident scene occurred. So I just want to give a shout out to them for their dedication. I mean, that shows what the citizens of this county and the volunteers are all about. And that's all I have. Thank you, Mr. Chairman.
Commissioner Smith.
Thank you, Chairman. Tonight, during National EMS Week, I would like to recognize the 41 dedicated employees who make up the Castle County EMS Department. These men and women serve our community with professionalism, compassion, and courage every single day. Whether responding to emergencies, providing life-saving care, or simply being there for our citizens in moments of crisis, they play a vital role in making Castle County a safer place to live. The commitment often requires long hours, personal sacrifice, and even the ability to remain calm under pressure. And our community is stronger because of their service. On behalf of the citizens of Castle County, thank you for each member of our EMS department for your dedication, your sacrifice, and your unwavering commitment to protecting and caring for others. We're grateful for your service.
Commissioner Todd.
Nothing, Chair.
Mr. Holt. All right, tonight's consent agenda consists of the meeting agenda, the minutes from our previous meeting on the 4th of May, and the tax refunds and release that you have in your packet. Any additions or corrections to our minutes? Hearing none, do I have a motion we approve the consent agenda?
So moved.
I have a motion from Commissioner Smith,
Second.
second from Commissioner Totten. All those in favor, let it be known by saying aye.
Aye.
Those opposed, motion carries. Board of Equalization and Review. Do I have a motion to recess as the Board of Commissioners and convene as the Board of Equalization and Review?
So moved.
Motion from Commissioner Rose, second from Commissioner Ingram. All those in favor, let it be known by saying aye.
Aye.
All those opposed. We now sit as the Board of Equalization and Review. Mr. Bernard. Thank you, Mr. Bernard. Do I have a motion we adjourn as the Board of Equalization and reconvene as the Board of Commissioners?
So moved.
Have a motion from Commissioner Ingram,
Second.
second from Commissioner Rose. All those in favor, let it be known by saying aye.
Aye.
All those opposed? Thank you, sir. All right, item 9, opioid strategies. Ms. Williamson.
Data identify needs, and discuss potential strategies for opioid settlement funding. So you're going to hear in a few minutes, I'm going to refer to sometimes where it will be reference to per 100,000 population. Of course, I know that is not our population for Caswell County, but the 100,000 residents is a standardized rate that public health agency rates per 100,000 populations. So counties of different sizes can be compared fairly. So this is NCDHHS takes the estimated number of overdose deaths and converts it into a rate per 100,000 people. Just want to make that aware that I'm quite aware that we do not have that many folks in Caswell County. The opioid committee is made up of many different agencies within the county and in county departments. So these strategies and these efforts are by far not mine alone. This is a collaborative effort of all of the agencies working together. So North Carolina data trends, next slide. North Carolina continues to experience significant impacts from the opioid epidemic. Since 2000, more than 44,500 North Carolinians have died from overdoses. In 2025, approximately 2,731 overdose deaths are projected statewide. The overdose death rate statewide is estimated at 21.1 per 100,000 residents. These statistics show why continued investment in prevention, treatment, recovery, and education remains so important. Next slide. Caswell County projected overdose death rate is estimated at 35.8 per 100,000 residents. Based on our population, this represents approximately 8 projected overdose deaths. Because Caswell County is a smaller county, even a relatively small number of deaths can create a higher rate per 100,000 residents. This rate is considered among the higher rates seen across North Carolina counties. The next slide. Caswell County overdose ED visits. The estimated overdose emergency department visit rate in Caswell County is 35.8 per 100,000 residents. This represents approximately 8 projected, like I said, overdose emergency department visits. While the ED visit rate is considered lower compared to many counties, overdose rates remaining a significant concern within many counties. Next slide. Illicit overdose trends. Approximately 50% of overdose deaths in Caswell County involve illicit opioids. That equates to approximately 4 projected overdose deaths involving illicit opioids. This demonstrates the continued impact of fentanyl and other illicit substances in our communities. And you can see the different rates there that are trending. Chart. Next slide. Opioid settlements. North Carolina is projected to receive approximately $1.42 billion in opioid settlement funds through 2038. Caswell County's estimated allocation is approximately a little over $2 million over that same time frame. These funds are restricted and must be used for approved opioid remediation strategies under the North Carolina Memorandum of Agreement. Next slide. This is just showing the settlement money, how it will be coming into North Carolina between 2022 and 2038. Next slide. And this is just some of the Caswell County has shared plans of between 2024 and 2026. We have did the collaborative strategic planning, early intervention, syringe service program, addiction treatment for incarcerated persons, and reentry programs. Next slide. In FY26, the board approved a resolution directing how opioid settlement funds would be spent. The county has worked to ensure expenditures remain compliant with the state requirements and approved strategies. Next. This is just a continuation of the 5 strategies that we had last year. Next. Use of settlement funds. Settlement funds must be used according to approved Exhibit A and Exhibit B strategies within the North Carolina Memorandum of Agreement. Examples include addiction treatment, recovery services, harm reduction, reentry programs, and strategic planning efforts. Counties are also required to track and report expenditures annually. Next. The FY27 recommended strategies that the opioid committee is looking at is the advisory committee is recommending approximately $247,000 in opioid settlement funding for FY20. Next. Addiction treatment for incarcerated persons. This strategy is supported through the Caswell County Sheriff's Office. The goal is to continue treatment for individuals already receiving treatment prior to incarceration. Services include voluntary screenings and continuation of medication assistance treatment when appropriate. The recommended funding amount for this is $85,000, and this also pays for the weekend nurse that they have to have there to be able to administer the medications. Next slide. Reentry programs. Like I said last year, this is one of those programs that kind of goes hand in hand with the MOUD MAP program that's offered when they're incarcerated. So when in the reentry programs, the services help individuals successfully transition back into the community following incarceration. Funding will support continued treatment, access, and assistance connecting individuals to healthcare benefits and supported services. Starting Point Rural Harm Reduction Coalition is a key partner in the efforts, and the total recommended for this funding is $60,000. And they actually are in the jail and work with the individuals while they're incarcerated and have a plan for them if they're interested once they are released, and they try to continue to follow them for about a year to see how their success stories are going. Next slide. Syringe service program. This strategy supports harm reduction efforts within Caswell County. Solid waste would assist with disposal through Sharps containers for fixed and mobile syringe service sites, and Starting Point would continue providing harm reduction education, supplies, and treatment referrals. And a combination of these two services, we're recommending $20,000 for this particular program. Next slide. The strategy supports community education, engagement, and opioid-related planning efforts. This is our collaborative strategic planning. Funding would assist with events like the one that we did in April, the outreach that we did in the community. That was a very successful event that we had here in the county. And we're also looking to have some funding for outreach materials and for promotional items. So to put on that event again and to have some things to kind of help have promotional items, we're asking for $12,000 in the collaborative strategic planning. Next slide. So a new strategy for FY27, this is proposed new strategy is focused on lower barrier access to treatment for high-risk individuals suffering from opioid use disorder. The goal is to improve access to care and reduce barriers to treatment. We're recommending funding there of $70,000. And this is actually through a doctor that's with Compassion Healthcare that would be assisting with this program and initiative. They have the same type of initiative in Guilford County, and he's been a part of the strategic plan, and the committee felt like this would be something that, you know, would be worthwhile trying in our community as well on a lower base, because I know we're not as large as Guilford County. Next slide, I'm sorry. This is just an update of to give you an outcome and some of the accomplishments through some of the programs that we have already provided with the opioid funding. The MAT MOUD program, This is through our detention center, and 3 inmates initiated treatment while 8 inmates continued treatment during incarceration. The MOUD stands for Medication for Opioid Use Disorder, if anybody's wondering what that MOUD program is. And programs like this are intended to improve recovery outcomes and reduce relapse risk upon release. Next slide. Starting Point Rural Harm Reduction Coalition, the Starting Point's reentry program began serving Caswell County at the end of 2025, and their goal is to connect incarcerated individuals with treatment and supported service following release. The program has engaged 32 participants to date. This includes both incarcerated and released participants currently receiving support. And I know Brandy said that it seems like the word of mouth is traveling through the jail and more inmates are interested in the program. So we do see where this started off slowly, but it has definitely picked up momentum. Next slide. The Hope and Healing in Caswell County, that was the big event that we had in April that was sponsored by the Opioid Advisory Committee. That was when I informed you all that we had probably at least 500 individuals that attended this event. It was very well received by the community. We were able to give out Narcan information, lock boxes, educational materials, and other resources, and we're able to provide other opportunities there to have things for the children and stuff to help engage and get the parents and the family involved to get them out there. And then they were able to see other education that they could get about the opioids here in the county. Like I said, we got a lot of great reviews back about that, and many have asked, will we be doing that again, that they thought it was great for our community. So I hope that we'll be able to do that again. The event demonstrated strong community support and engagement around the opioid awareness and prevention. Next slide. Just the Caswell County Opioid Advisory Committee would like to thank the commissioners for being supportive. We're not asking for any action tonight. Just wanted to share with you what our strategies are for FY27. That will be part of the spending authorization that I present when we do the budget. And that's the funding that we will have appropriated for the opioid strategies for FY27. This is just an opportunity for you to be able to hear about the strategies, for anyone to provide input back. And I also plan to share this at our joint meeting as well. So if Yanceyville and Milton would like to add any input or anything, we can definitely be glad to hear from them as well.
All right. Any questions? Thank you, Ms. Williamson.
I'm going to introduce you next.
All right, the item 10 is the Caswell County Water System Management.
Josh Johnson with Allie Williams, Cameron, and King will be presenting information regarding the Caswell County water system and the proposed agreement for water system management documents and a water rate analysis. Caswell County owns and operates a small water system and has been since approximately 2010. That these types of management documents and evaluations have not been updated since then, since 2010, and our rates are extremely low, and the board needs to consider this tonight so we can definitely be in line with where we need to be for what we're charging for water and for taps. So the proposal also includes that we will have coordination with NCDO DEQ public water supply sections to help determine any additional requirements or documentations that we need to move forward. And it will update our documents, like I said, that have not been updated since 2010. So I will turn it over now to Josh Johnson.
Ooh, don't break it. There we go. Good evening. I'm Josh Johnson, I Williams, Carmen and King. Couple of short slides, and then any questions that y'all have would be great. Thank you for having me. Couple weeks ago, RD contacted me and had some questions about the water system and management of it, what they need, what the county needed to do to protect the water system from cross connection, and just general concerns about the about how y'all needed to operate the system and how you needed to maintain it and what kind of documents and what kind of rates you were typical. If you go to the next slide. So the county has two water systems, as Ms. Williamson said, two public drinking water systems that are state regulated. Both are very similar. You purchase water from the city of Danville. Well, you don't use a lot of water. They're both kind of, we'll call them relic systems, but they are community water systems, and the state regulations do apply, and you do have the public drinking from both of them. Over the last 15 years, your rates were set in 2010. Since then, everybody else in the world has gone up on rates, basically, including the city of Danville, and the rates for the system have stayed the same. The documents surrounding the system, as far as the programs, cross-connection policies, water shortage response plans, a lot of those things have evolved in the last 15 years, and they have not been updated with the system. And if you go to the next slide. According to DEQ, you're up to date on your water quality sampling. The gentleman who does it for the county does all his sampling, but as I just said, the fees were set up 16 years ago, have not been updated. The regulatory requirements have been strengthened since then, and some of the policies have not been updated. The current requirements require more oversight and new development opportunities with the growth, in Danville, the growth in Caswell County. You're going to see additional stresses on that. And then next slide. Thank you. The proposal includes, as Ms. Williamson said, the proposal includes a rate analysis, but very simple rate analysis and a fee schedule update. Which will include some basic capital improvement planning. As an example, right now, for basic, simple standards, right now, the Caswell County is reimbursing or is covering the shortages in the water system, and anything that breaks is going to have to go back and be paid for out of tax money rather than out of a water and sewer fund or out of money that's generated from the users of the water systems. It would also include water system management documents, which would be your update to the water system management plan, the water system O&M documents, which operation and maintenance, water shortage response plan, and the cross connection ordinance and program. I know that in speaking with RD, one of his primary concerns is the cross connection program. Cross connection is a big thing in drinking water because it's their standard backflow. So if the system ever drops in pressure, what happens is you can suck things back into the drinking water, into the system, which then you can send to other people. And it sounds like something that shouldn't happen, but it happens. That siphon effect happens quite often. And without the proper documentation, without the proper requirements, it can be a real problem, and it can damage your water system, and as well as provide pollutants back to other users of the system. There's also a allocation in there for coordinating with public water supply, which is DEQ's water supply section. So the proposal itself is hourly, so it's a set amount, but it doesn't go over that. So the idea is to get those things up to date and kind of update your system from where it was when it was first created in 2010, 2011. With that out, any questions or?
Questions?
Mr. Chairman,
Yes.
this operating agreement is going to include fees for water, sewer, and fire taps. Is that correct?
Water, not sewer.
Okay. Will there be a fee for sewer taps?
As far as I know, you don't operate a sewer system as part of this. Or that's right, separate, sewer is separate. Can hear you. Okay, but that's separate. That is separate. But yeah, That is easily incorporated in as
Yeah.
as the tap fee to it. Yes, that is easily
There was a
incorporated
lot
in.
of confusion. We had an industry move in a couple weeks ago, and a lot of confusion as to how much the tap going to be, who they paid and so forth.
Mhm.
And I'd like to see something real clear on the sewer and fire lines, because sometimes you get a 4,
Mhm.
6-inch fire line and, that could be a significant amount of money.
Yes, yes, the fire lines definitely, the sewer system tap fees and the fees, that's easy to incorporate. Yes.
Will it also indicate whether there's to be a vault installed or you can install it inside the building or?
That would be included in the ordinance as to what was allowed and what type of backflow was required for each different use.
I know some years back, the town of Yancey, in my opinion, made a real mistake in imposing an impact fee on new industry. And we had an industry we're working on, and we lost that industry because the impact fee was so large. So we discouraged that. So hopefully this will not come up again.
This is not an impact fee or development fee study. No, sir.
Mr. Chair,
Yes, sir.
aren't these tap fees from 2010? It's listed in the packet.
It's,
Well, having done some research, it appears that the average tap on fee in North Carolina today is between $400 and $2,500. That's a pretty substantial difference. The Caswell County Water and Sewer Rules and Regulations, paragraph 4B, states tap fees shall be routinely set by county commissioners. And I think it's about time.
been 16 years.
It's been since 2010, since we updated it. And also, just so you know, like over at your Pelham Industrial Park, those individuals are paying $10 a month for water. So that is by far covering our cost. And I know our deputy finance director ran some numbers for us today, and just year to date, that's over at the Pelham Industrial Park, it's $13,726.51. And another thing that the board may would want to consider, from the water from Danville to North Elementary, so far, year to date, is $8,834.64. You have some businesses, and I know a church through there that would love to tap into that line. And that should be something I think the board should consider, because you could have them helping pay for this. And because we're paying someone to pump this water off just to keep the chlorine levels to where they need to be, because it's not being used enough to keep it, where it should be maintained at. So instead of pumping it off, we could have other people on this line paying us to use it to help offset this cost that, the school, what it's costing us to run that line there. Just a thought while we're doing this.
Mr. Chairman,
Yes.
Madam Manager, is that something, I guess I'm gonna add, is that something that we would have to talk with Danville about if you start adding more people onto that line and utilizing more water? Is that something that they would have to?
Artie, you tell me if I'm wrong on this, but were we not told today that it's costing us to?
'86, it goes dead. We're back feeding from Yanceville, from Danville to feed Yanceville. So when all this stuff happened, I went to digging into it, and this is when I found a lot of this out. So I went to Melissa and I was like, we're throwing a lot of money out the window. So the line that leaves Jenny Lane and feeds the elementary school, we've been supplying water to the elementary school for years. It runs us anywhere from $600 to $800 a month. It makes no revenue whatsoever. We basically give it to the school. The reason why the bill's that high is because there's a hydrant behind that school, and state maintained, you gotta have between a 1.4 and a 1.6 chlorine reading. So if Appleboone or somebody walks in that school and they get a 1 point reading, they shut the school down, kill the water immediately. So we have a hydrant outside, and Andy Butts that works for me, he flushes that line and keeps the chlorine reading up because we have paste come out. Now that we're back feeding Yanceville, the line stays pretty good now. So what I've done this for 25 years. if you have other people tie onto the line, other counties, and Josh will tell you this, small counties, Elon, Gibsonville, Hall River, places like that, that don't have the men and the power to do it in-house. Caswell County don't even have a license. They're using my license to inspect Cherokee right now. So you have to get a utility contractor out. They look at the tap. If it's a 1-inch tap, 1-inch taps now are going for anywhere from a commercial from 2,500 to 5,000. 4-inch fire tap, 10 to 15,000. And that's in small counties. Right now, the county's at $150 for a 1-inch tap.
Right.
But if you got more houses that tie onto it, what I suggest, you get a contractor to look at it. If it's a house or something, it's a 3/4 tap. You go to Jerry Warren, seeing your utility somewhere like that, somebody that knows the system. They do all the Answell's work. They tell you the tap fee, the county comes up with a percentage on it. That percentage is put, say the county makes $3,000 off of it. That's put in a separate line, no fund balance, no nothing. Because we have to go back and maintain the meter, the setter, and a 2-foot pigtail.
Yeah, I guess I just want to make sure that, like you said, the church, wanted to tap into it. So let's just say we've got 30 people in that area. Well, if you open it up and let one tap on, then you may have others that won't.
The thing about it is the more the merrier.
Right, but what I'm getting at is this: the water's coming from Danville. Now, everything that's going on right now with the town, they're guaranteeing us a certain amount of water. I just want to make sure that if we were to do that, one, if they wouldn't come back and say, well, you can't put on but 10 people. That's all we're going to let you have.
Mhm.
And secondly, with what they had go on with their system, they shut the water off coming over here.
Mhm.
So that's one thing people need to look at is, they're supplying that water. And if something happens over there and that line goes down, then they won't have any water if they elect to tap onto it. I just want to make sure Danville doesn't come back if we elected to do this and we had multiple people say, well, I want to tap on city water. And we did. And all of a sudden we find out later, Danville says, nope, we're only going to let you have this many 1,000 gallons of water and it's not going to be enough to suffice.
We would definitely research that, of course, further, but we just was putting it out there. This may be a
Right.
consideration that the board maybe would want to look into. And if so, if you give me the okay, RD and I can do more research on that.
Second question I've got is how are you going to come up with some type of new fee placement for these water bills?
Yes.
All right, so instead of them paying $10 a month,
Yes.
paying according to how many
Exactly.
gallons of water they're using.
Yes.
And I had some discussion, I know with Russell, that I'm sure we would have to give them a courtesy 30 days notice,
Right.
send them a letter and let them know, but they have had quite the deal for quite some years now.
Oh, yeah, because I've seen some of the water bills.
Yeah.
They're pretty expensive. Thank you.
And just so you know, we do have this in our FY26 budget, in our maintenance budget that would be able to cover the cost of this. So this would not be something we would be pushing out to FY27 because I know that's a much tighter budget that we'll be working with. So we do currently have the funds, and Ms. Sharp did check on that and said that those funds were available in our maintenance budget.
That's all, Mr. Chairman.
Any other questions? Gentlemen, would you like to act on this tonight, or since it was a discussion item, push it back until our first meeting in June? What's the preference of the board?
Can I say one thing?
Yes.
Already, and I'm just bringing this up because of the backflow, the cross contamination, the tap fees. I mean, I'm getting multiple calls from PCC wanting to know the prices of taps and stuff. And now they're talking about building the Handy Mart on the corner out there. And 3 contractors have contacted me last week wanting to know our tap fees. And I've told them I actually talked to Russell and he told me to blame it on him for right now until we come up with something.
Is it consensus of the board, we act on this at June, at our meeting, first meeting in June? Will that suffice everybody? Right at time.
Mr. Chairman,
Yes, sir.
I recommend that we have Melissa and RD do more research
Yeah.
on adding those additional taps along Jenny Lane coming off the city of Danville line.
Just to make sure that the city is good with what we're thinking about.
Yep.
All right. Thank you, Mr. Johnson.
Thank you, sir.
All right, item 11, Castle County Veteran Services, Mr. Newcomer.
Did you want me to start?
And I reckon Mr. Smith, I don't want to leave him out.
Mr. Chairman, Commissioners, I want to thank you for this opportunity to come speak to you tonight. We feel like there's been a little bit of a avoidance of something that the county has not looked at closely for the veterans. And what we would like to do is provide some information for you to examine on what we call a VSO, a Veteran Service Officer. That's a person that is responsible for helping veterans file claims, disabilities, whatever help they need with the VA. Castle County does not have one. We are one of only 3 counties in the state that does not have a VSO. We would like to provide you with some information about what a VSO is.
I told Mr. Smith I had talked with Lee Ambersold with the North Carolina Department of Military and Veterans Affairs today to try to get some additional information on what they were going to be presenting tonight, because I think it is a very important service that we offer our veterans, especially with the cost of gas right now having to go into neighboring counties. And I did ask that I knew some things are starting to pass through the state budget. So of course I asked, was it by any chance that this is something that would look at being resolved anytime soon? He said no, that the state budget still did not provide them to be able to allow us to have a VSO officer. So after talking with him and talking with Mr. Smith, I know that Alamance County has a director and 3 VSOs. And I think our best bet might be to, due to the budget crisis that we're having in 27, because we really can't afford to bring our own FSO officer and pay them 20 hours a week, would maybe to do an interagency agreement with Alamance County. And I think they're one of the counties that would probably be willing to do this for us. I haven't had an opportunity to reach out to see what that may cost us, but you've got to remember we won't be providing benefits or anything to this individual. We'll just be paying for the days and the hours that they actually do serve here in Caswell County. And Lee gave me some interesting information that I did not think about. One, we do have probably 1,316 veterans that are listed. But if you compare that to the census, there are a number of veterans that are not receiving any benefits at all. So that we do have more veterans, I'm sure, than that here in the county. And he said 465 are receiving disability. That's $9.9 million that's coming in to these veterans here in the county. And when you think about that, in turn, that means that's money that they're bringing into our county and could be spending in our county. But we need to have a representative here who can help them to ensure they continue to get their benefits. And also, this was the information based off of FY24 between benefits from the VA, the disability benefits, the VA loans, education, medical, and the disability, they received $24.6 million. So you have to look at it, that is almost like a revenue that could be coming back into the county. And if we had a VSO officer, like Lee was saying, if we've got 465 veterans that are considered having a, being disabled, I'm sure there are plenty more if they had the right VSO officer to work with them, then they would be getting these benefits as well. So I think it is something that, that we should look into, because our county and our veterans deserve to be served just like every other county. And I think it's kind of unfair to ask them to go into neighboring counties right now, especially as high as gas is. He did tell me that they are, working on a software program that will allow them to work virtually soon, but not yet, with rural counties. And that way they can at least make contact with them, virtually, when there's times like this that we don't have anyone and they need assistance. And also that the feds and state are looking at grant opportunities to help pay for a VSO, but that's not available at this time. But that may be something that, opportunity that we could look at later. But I do think that this is something that we should look into. And I'm not sure if you all were able to get any prices from Alamance. If not, I'd be happy to look into that for you.
That's it. That's it. I didn't need to come. I'm Fred Smith. I got a 30-minute speech, but I'm only 5 now. So let me do my front part. I'm Fred Smith. I live at 820 NC Highway 62 North, Blanche. I'm a Vietnam veteran serving in 1967, 68 with the Marines in Vietnam, combat veteran. I'm in 5 different veteran organizations. I'm very active in VFW Post 7316 and American Legion Post 89 here in Casville, Yanceyville, Casville. I served as commander of VFW Post 7316 till I conned him into taking. I served for 17 years as commander. I am now the senior vice commander. I'm also an officer in American Legion Post, helping veterans and helping with projects in Casville County has been a part of my life since 1995 and will continue. Whether you know it or not, I'm gonna go over just a little bit. As a commissioner, I know your job is tough. I served down the hill a little bit and was a little tough down there, but it was nothing compared to what you all go through. So for y'all's decisions, which we don't want a decision on anything tonight, you're damned if you do and damned if you don't. And I understand that. So, and we as veterans understand that too. Tonight, no decision is warranted. The 1,300 veterans Melissa went over. And let me tell you, Melissa's been great coming up here, talking to her with her information, and they're doing their research. I made telephone calls today and they said, well, somebody's already called from Casville, and I knew who it was. So I appreciate her doing that. A VSO, I've been in the VA systems, well, actually could have been in since 1969, since I got wounded twice in Nam, but I didn't go to the VA system till 2007. And I went through a veteran service officer. That's what 14 years or whatever I worked to get it into the VA system and get my benefits that I could have had in 1969 that I did not take advantage of. A little history. American Legion Post 89 was chartered back in 1932. The FW Post 7316 was chartered in 1946. The veterans returning from wars in that area of time, especially 1946 to World War II veterans, they're the ones that formed this post, these 2 posts. We do have two other American Legion posts in the county. We got Prospect Hill and we got Cassville. We got those 2. American Legion Post 89 was best known and probably well known in Casville County for the Casville County Agricultural Fair. Back many years ago on County Home Road, where our property is located now. The fair then was for farming and agricultural stuff, and when farming was the big thing, tobacco was a really big thing. So that's where the money from this county came from, was farming, and it still is a very important part of this. The most important part, I guess, to remember, these people that were in these organizations, post 89 and post 7316, were leaders in this county also. A few of the names I'll give you, and I'll just give you a few. Mr. Neil Walton, J. Neil Walton, Henry Gunn, Clarence Pemberton. Some of you people don't know these people. I'm old, so I know part of them. Bob Blackwell, U.S. Navy World War II veteran, Lynn Banks Williamson, Wilbur Page, and many more. And many of our veterans today serve in capacities that support this county and support their churches or whatever. But some of the things I want to tell you about that we as veterans, post 89 and post 7316, and I'm not sure what the other two posts do because I deal so much with this. The Castle County Veterans Memorial that was dedicated November 11th, 2020 down here was put together by veterans. It was our committee. We had 8 to 10 veterans on that committee all the time. I was chair of it. We had 21 members that first started that effort. At the end of like 6 or 7 years, we still had 17 active members that started with us. So that's very good for that. We raised the funds, we planned, we did the construction, had it done. And you know, the main thing is no tax dollars in that memorial down there. So I'm very proud of that. Since 2017, with the guidance from this guy standing behind me, I was a smart guy one time when I made him the project manager of the ramp committee. Since 2017, we have built 111 ramps in this county. On May the 9th, a couple of Saturdays ago, we built 2. This was a nationwide effort that every VFW post in the United States was supposed to have a community project. So that was our community project that day. One was a 20-footer and the other was a 40-footer that we completed on May the 9th. So we've done those. The VFW Post 7316 in 2018, Keith and I went to Kansas City and received a Community Service Award as a national award. We, along with this board and the town of Yanceyville, are planning a Charters of Freedom Memorial that deals with the Declaration of Independence, the Bill of Rights, and all this to be put down here. And I would like to say Commissioner Tony Smith is going to help us a lot on that. I know he will. I know his phone number, and I know where he lives. So our post does military honors for veterans that pass away in this county or buried in this county. We have one outside the county a few times. We present the colors at Piedmont Community College graduation and Bartlett Yancey High School graduation each year, as well as Special Olympics. Flags on the square on every holiday. You'll notice how you have Flag Day, Memorial Day, Veterans Day, and the 4th of July, they'll put up by veterans. Also, there are 14 veterans or their families serving with the Meals on Wheels program at the Senior Center. I'll stop for now. That's just a few, and I gave y'all a list of the majority of things that we do. I would like to thank Melissa for her work, especially her. We veterans do need a veteran service officer. They control applications for disability, spouse, dependents, burial benefits, and all this stuff. They control that, help us greatly. And they're funded by the state with the exception of 3 counties. I will say that we do not, I'm like Melissa, we don't need a full-time veteran service officer here. We do not, I think that can be negotiated with what we needed. We were presently, till about 3 months ago, getting 2 days a month. And I will say Wanda Jones, the veteran service officer we had, did a great job. She helped me a lot the last couple of years on different items. She's helped a lot of people in this room and a lot of veterans that you won't see and hear from. Let's see. So there are several options, and Melissa went over that. I'm not going to go over that, but some of the things that the VSO does, I went over that. Health benefits, disability, burial benefits, spouse and dependent children that need assistance. Now, Alamance, Rockingham is where you have to go. We, the veterans of Caswell, are asking for your consideration in this matter. We're willing to sit and give our input, and hopefully a solution can be signed on soon. I spoke to Rita Honeycutt today, that's the NC Department of Military Affairs Regional Manager, about 3:45 this afternoon. The state budget so far has not opened up for funds for our VSO to travel. Travel was a big deal when the budget stopped. She did tell me that the only thing that's the military and Veterans Affairs part that was released was some scholarships they had out of the state. That's the only thing that's been released. If you have questions that I can answer, or Keith, or I guess Melissa, we're ready.
Questions? Yes.
Excuse me. Melissa, you said you was going to look at reaching out to Alamance about, maybe we can bring it up, you know, that old saying, more hands kind of takes care of the load sometimes. Maybe we can talk, we got a joint meeting coming up with the town, and I know there are several veterans that live in town. Maybe they would look at wanting to partner with us on this part-time position. You know, we're all in budget right now, and I do understand that. But it could be that we could maybe see if we could put it together, you know, between the town and the county, you know, pull the resources together to get a part-time person. We probably got some room at Cove Square. When that person came, we could let them utilize one of those offices there that,
They've been meeting at the senior center.
yeah, they, okay.
Mhm. That's where Wanda was coming, was at the
Okay.
senior center. I can give Alamance a call and just see what it would cost. Fred, do you have any idea of how often that do you think we need someone once a week or twice a month? What were you thinking?
I will stick with twice a month.
That's kind of what I was thinking too. If we at least had twice a month, that then we would be able to, that would be more affordable too, and they could see more people at one time instead of having it so scattered during the time
I
they're
think it
here.
would have to be, you'd have to schedule them for a day, because you don't know how, for the five
Right.
sign up or 10. We have a sign up sheet at the front when you come in. So you never know. It would be hard to get with all the veterans in the county and say,
Right.
well, you need to call for this appointment. That wouldn't work, I don't think.
And then we could be sure maybe in the senior center newsletter that they send out as well, like they could put the dates if it works out, so veterans would be well aware. And maybe we could even, you know, initially getting it started, maybe could put something in the messenger as well, so we could try to reach as many veterans as possible that might need the service.
Well, prior to this shutdown, it was the second and fourth Wednesdays
The second and fourth Wednesday.
prior to this.
Any other questions?
Mr. Chairman,
Yes.
Fred, in the past, you had a part-time BSO officer to come in. Who paid for that? Did the VFW pay for that? Was that paid by the VA? State, okay. Are they paying the officers in Alamance County too?
Yes.
Okay, but we would have to pay,
Commissioners are.
They are actually paying for their officers.
okay,
The county pays for their officers. We were not paying for ours, you know, we were able to get through at that time because they were only coming twice a month. But I do know Alamance pays their director and their 3 VSO officers. But with the interagency agreement, you know, they would probably be willing to work with us. You know, we would just have to pay the fee that they set, you know, for that. That's what I can find more out what that would cost us.
okay. You said the VSO officer stopped coming, for one reason is the cost, travel cost.
That's our
Would-
first thing they told us was travel.
Same thing.
Would they be willing to come back if we paid them for some travel?
Something somebody else have to answer. But I will say, on a Tuesday, I think it was March, on a Tuesday before the fourth Wednesday, whatever that date is, I talked to Rita and what's the guy?
John.
Anyway, I talked to him and he says, we're on, you pay the travel, you get 6 people, 6 veterans that need assistance.
Right, right.
We will come. Well, the next morning when I got to coffee and conversation, the ladies came to see me and said, Fred, BSO is not coming anytime. It was cut completely off. That was the 4th Wednesday in March.
Yeah. And we were told that if we had a list that they would, and then as quick as we were told that, then that changed as well. And I know Lee with Veterans Affairs said they only had enough money to maintain their offices being open. And he recommended that Veterans Affairs have even reached out, I think, like to Alamance to see if they would be willing to partner with us, since they do have 3 VSO officers. So that's what he suggested would probably be our best bet right now, is to do that. And then we could bring them here to our senior center. But I'm not sure right now what that rate is. I'll have
Okay.
to check into it.
And
Any
one
questions?
thing that you
Yes.
need to remember too is that we have a lot new veterans coming into the county that have either been discharged or retired or whatever. And they are filing with the VA for benefits, which means that's additional income coming to this county. But if they've got to go to Alamance or got to go to Rockingham or Orange County, some of them won't go because that's too far to go. A little bit of travel money for paying for the VSO from Alamance County to come here probably would be very beneficial. You would see some of the guys signing up. I just recently signed up. I've been out for 30 some years. I had to go to Alamance County. I mean, that's kind of unfair that we're asking Alamance County to file for veterans that live in this county. Thank you, gentlemen. Appreciate it.
Any other questions, gentlemen? Mr. Williams, and see what you can find out.
Okay.
We
Thank y'all.
certainly want to help this group of individuals if at all possible. Thank y'all. All right, item 12, AEMT pay grade.
Thank you, Mr. Chairman and Commissioners. Before I begin, I'd like to thank Commissioner Smith for recognizing EMS Week. I'd like to reiterate what he said and thank the men and women of Caswell County EMS for the work they do every day. They answer calls at all hours of the day and night, in all conditions, and continue to provide professional care to the citizens of this county. I'm extremely proud of the personnel and the service they provide. Tonight on your agendas, we're revisiting the discussion regarding the creation of an advanced EMT pay grade within Caswell County EMS. When this was previously presented, one of the concerns raised by the board was financial sustainability. I believe this is an important question, and honestly, it's the same question we have to ask anytime we discuss staffing, recruitment, compensation, or operational changes. We have to make sure that whatever we do today is something that the county can continue supporting long-term. The reality is EMS is changing statewide. Rural counties such as ours are no longer competing with just neighboring agencies. We're competing with hospital systems, larger municipalities, and private agencies across the state for a very limited number of paramedics. We just had 2 employees finish paramedic class in March. They had a class of 6 total students to graduate. The traditional model of simply advertising a vacancy and waiting for experienced paramedics to apply is no longer reliable. Because of that, we've had to adjust our approach. Instead of relying entirely on outside hiring, we are focusing on building our own workforce internally. We're identifying employees who want to grow in this profession and helping them move forward through the certification process while they continue serving Caswell County. What we are asking for tonight is not the creation of additional staffing or expansion of the department. This is about recognizing the certification level that already exists within North Carolina EMS education and using it strategically to strengthen our workforce pipeline. The advanced EMT level gives employees an achievable next step between EMT and paramedic. It helps retain motivated personnel who are continuing their education, and it allows us to develop future paramedics from within our own organization instead of hoping to recruit them from somewhere else. From a financial standpoint, this proposal remains sustainable because these employees will already be working in a paramedic position that is currently budgeted. Even with the proposed pay adjustment, the county still realizes savings compared to staffing those positions at the full paramedic rate while they are in school. More importantly, this creates long-term value for the county. Every employee we help progress through the system is an investment in workforce stability, retention, and continuity of service. Employees who grow within an organization are more likely to stay within that organization. They gain experience within our system, become familiar with our county, our citizens, and our operations, and they help strengthen the department over time. At the end of the day, this proposal is about preparing Caswell County EMS for the future in a practical and financially responsible way. It allows us to continue building a stronger workforce while staying within the framework of the staffing model and budget already approved by this board. I appreciate the board for allowing us to revisit this discussion and appreciate your continued support of EMS and public safety in Caswell County. And I would be happy to answer any questions you may have.
Mr. Chair.
Yes, sir.
So there is no additional funding for this.
Correct. These employees would be in paramedic positions, not making the full paramedic rate while they are advanced EMTs.
How many in the county are currently qualified for this?
How many employees?
Yeah.
3 currently.
So we have 3 qualified to be at this step.
Correct. And 2 of those 3 are currently in school to become paramedics.
Okay. And no additional funding, 3. Got it.
Correct.
Thank you.
Yes, sir.
Any other questions?
John, excuse me.
Yes, sir.
Under this EMT advanced, they're allowed to push more drugs than the actual EMT
Yes, sir.
is allowed to push.
Yes, sir.
correct?
Their scope of practice has been significantly expanded over the past couple of years by the state,
Right.
to where they can do the vast majority, of what a paramedic can do. A paramedic can still do more advanced things, but it's been expanded tremendously compared to what it was even 5-10 years ago.
Thank you.
Any other questions?
Yes, I have one, Mr. Chair.
Yes, sir.
What is the current paramedic per hour pay rate?
We start at $22.20 an hour.
That is right now.
Yes, sir.
Mr.
Yes, sir. John, I just need to know, because I see the rates right here and just doing a little research on my own. Just give me a little bit of a difference of the ones, I guess, that's surrounding us, because if I'm looking advanced EMT person, here in this county would be making, no, a paramedic. Or I'm sorry, an advanced EMT person in another county would probably be making far more than a paramedic here in our county. Is that correct?
Yes, sir. Paramedics in Caswell County start off at $22.20. With the last 2 COLAs over the past 2 years, I think it gets them up to about $22.98. That's still below all surrounding counties. Alamance County is at $24.47. Person is at $24.54, and I think they have recently went up since I got these numbers. And Orange is up at $27.03 for paramedics. EMT, that's an average of $2.43 from all our surrounding counties. EMTs are even at a bigger disadvantage because the average is about $3.70 that Caswell County EMTs are making less than surrounding counties.
Any other questions?
Thank you.
Mr. Chairman.
Yes.
Madam Manager, you have gone over these numbers, you and Finance Director. There's no additional cost concerning this, correct?
Correct.
Thank you.
What's the pleasure of the board?
Mr. Chairman,
Yes.
I move to approve the establishment of a dedicated AEMT pay grade.
We have a motion from Commissioner Smith to approve the AEMT pay grade request. Do I have a second?
Second.
Second from Commissioner Ingram. Any discussion? Hearing none, we'll proceed to vote. All those in favor, let it be known by saying aye.
Aye.
All those opposed, motion carries.
Thank you,
Thank you,
Commissioners.
sir. All right, item 13, the 2026 Caswell County renewal proposals. Ms. Williamson.
Tonight I bring before you the renewal proposal for liability and property and workers' compensation coverage through the NCACC risk management pools. That's what I'll be presenting tonight. There was an increase, as you've seen, for the liability and property insurance of $16,596. But the workers' comp, we did see a slight reduction of $129. So I'm just going to give you some of the reasoning for why we did have that increase. The increase in the property insurance renewal is largely tied to increases in property values and replacement costs. Even when buildings are not physically reappraised, the insurance pool automatically applies an annual inflationary adjustment to account for rising construction costs, labor, and materials. This year, that increase was approximately 1.5% across the board. In addition to the inflationary increases, the county did request an increase in the insured value of the 911 building. We only had it insured at $800,000, and we definitely could not replace that building at that price, especially with the equipment that's in there. So that was adjusted to $3 million to better reflect the true replacement value of the facility. And we do ask each department to go over an Excel spreadsheet that we send them with all of their property and vehicles and stuff that are on there for them to look at these values. And that's when that was noticed that the 911 building was only being valued at $800,000. The increase in law enforcement liability coverage is being driven both by national insurance trends and the county's own claims experience. Across the insurance industry, settlements and legal costs related to liability claims continue to rise significantly each year, even in cases where the final settlement amount may not be large. Attorney fees and litigation expenses alone can become very costly. Castle County also has an open law enforcement liability claim from FY 24-25 that has not yet been fully resolved, which also impacts renewal costs. Overall, the increase reflects both higher insured property values and continued rising liability costs within the insurance market. So our FY 26 liability and property is $364,853. That was 26. And for FY 27, it will be $381,449. That's your increase of $16,596. And for your workers' comp for FY 26, it was $201,801. And for FY 27 is $201,672 with a decrease of $129. But this is through the ACC risk management pool that we've always been with, and with the combined rates with everything that they offer to counties. Most of your counties, this is who they continue to stay insured through. So I know last year the board gave me a consensus for us to be able to proceed so that we are fully insured come July 1st.
Any questions? Comments?
Mr. Chairman,
Yes.
I think for us to have a reduction of $129 in workman's comp insurance is saying a lot for our safety program, because I know wages have gone up, increases. So, it's looking at, how many accidents we had. So obviously we had fewer accidents. Thank you.
Correct. I noticed that as well.
Yep.
So what you need, Madam Manager, is just consensus from the board to move forward so you can include this in the budget.
Yes. And that you approve the rates and that we can move forward with the paperwork so we are insured July 1st.
And I believe in a prior conversation, you said that, pricing it from somebody else was probably useless.
Yes, and just all the benefits that you receive through the NCACC. We receive so many other services as well through them.
Okay. The consensus of the board to move ahead, stick with this same carrier. All right, you have your consensus.
Okay, thank you.
Madam Manager, thank you. All right, next is the EMS and CATS roof contract.
The Custom Coatings Incorporated for the EMS roof restoration project located at 200 County Park Road. That's our next item, and this project includes installation of a fluid applied roofing system and restoration of 6 skylights at the EMS facility. The total contract amount is $52,595, which was previously approved in the FY26 budget, so it has been budgeted for. The contract also includes warranty provisions, performance and payout bond requirements, insurance requirements, and project completion timelines. At this time, I'll turn it over to County Attorney Johnson, who drafted the agreement for the county.
Thank you, Madam Manager. Mr. Chairman, members of the board, good evening. The contract you have before you, as Madam County Manager mentioned, does have certain waivers of liability to protect the county, along with minimum insurance requirements governing workers' compensation and employers' liability. And I will bring to your attention, it's on page 93 in your agenda packet under supplementary general conditions. I would recommend one modification. Under time of completion, in the current form of the contract, we're giving the contractor 5 days to complete the project. And I reached out to our maintenance director, R.D. Hayes, today, who's been in consultation with this contractor, and they agreed that 30 days would be a reasonable timeline from the execution of the contract to the completion of the project. So I would just ask, if you choose to move forward, let's modify 5 consecutive calendar days to 30 consecutive calendar days.
You've looked this over and are satisfied with it, Mr. Attorney?
Yes, sir, Mr. Chairman. I drafted this at the direction of our maintenance director and our county manager, and we do have provisions covering waivers of liability and our insurance and bond requirements for the job and property insurance for the structure. So yes, sir, Mr. Chairman, I'm comfortable with the legal form of the contract.
Questions?
Chairman.
Yes.
Russell, would that also, the bonds include a payment bond and a bid bond?
I'm sorry, Mr. Smith.
The bonds that they're proposing includes payment bonds and bid bonds?
That's correct, Commissioner
Okay,
Smith.
because there's quite a bit of difference in their bid and the other bid, so yeah, that would lock them in.
Certainly.
Okay, good.
Is the money already there for this project?
Correct. It was budgeted for FY26. This was one of the projects that was presented by Mr. Hayes when he did his budget for 26. So it's in his budget.
Mr. Chairman.
Yes.
Madam Manager, I may be overlooking it. What's the warranty on this?
Commissioner Rose, is that the warranty for the materials or the job itself?
Job itself.
Commissioner Rose, if I may, Madam County Manager, under section 22 of the contract, under guarantee,
Okay.
I do see some language in here.
It's like 12 months. Is that correct?
Yes, sir, that's my understanding.
Any other questions? What's the pleasure, board?
And Mr. Chairman, if I may, Commissioner Smith, in reference to your question, there is language in here referring to bonds. And I'll be glad to do a little further research if we need to tighten that up in reference to your concerns. I'll be glad to do so.
Normally, when you bid a project, you have all three, but it did mention just performance. But of course, we need a payment bond to make sure they pay their bills
Right.
on the project. Yeah.
Well, Commissioner Smith, I'll look through this again. If I'm not totally satisfied with that language, I'll confer with you. And if we need to add additional language, I'll be.
Okay.
With that being said, Mr. Attorney, would you prefer that we hold off on action?
If we want to err on the side of caution, yes, sir, Mr. Chairman. I'm not sure of the urgency of this contract yet. That may be a better question for Mr. Hayes if he's still here.
Go ahead.
Well,
Go ahead.
in that case, Mr. Chairman, then I'd like to confer with Commissioner Smith and make sure we have his language solidified in this contract.
If it's agreeable with the rest of the board, we'll hold off on action until our first meeting in June.
Yep.
That suits everybody. Right? Okay, the NCDIT Brightspeed Amendments. Mr. Johnston.
Thank you, Mr. Chairman. Again, members of the board, several meetings ago, there was a concern over the completion of the infrastructure of this project, and then the certainty that Brightspeed would come out and repair any flaws or defaults in the infrastructure. So just to give you some background information, the contract for the grant agreement was executed on September 19th of 2024. And at that time, Brightspeed had 2 years to finish the construction of the infrastructure and the installation of the lines. After that 2-year period, Brightspeed is required to have a 3-year maintenance period to repair or be certain that the infrastructure is working for the customers. And the construction date from my communications with Brightspeed and the NCDIT is set to end on October 31st of 2026. And Brightspeed is required to have a maintenance period through September 11th of 2029. And there's also language in section 2.4E that requires a cash match of $236,786.85. And the language in this agreement requires Brightspeed to maintain those funds in an account for the 5-year duration of the contract. And of course, there's also a bond requirement in the agreement as well. But I think specifically, this board was concerned about, after the construction of the infrastructure, that maybe Brightspeed would not be required to come back and repair any flaws in the infrastructure if need be. And I do believe this 3-year maintenance period would cover that.
Any questions? This satisfied the concerns that were raised, about a month or more ago?
That's correct, Mr. Chairman.
Do I have a motion that we approve this amendment to the Great Grant Agreement?
Mr. Chairman,
Yes.
I'll make a motion to approve amendment number 2 to Great Grant Agreement with North Carolina Department of Information and Technology Connected Holdings LLC, DBA of being Brightspeed, as presented and authorized the interim county manager or her designee to execute all necessary documents.
I have a motion from Commissioner Rose. Do I have a second?
Second.
Commissioner Ingram, second. Any discussion? All those in favor, let it be known by saying aye.
Aye.
All those opposed? Motion carries. All right, we're down to appointments. First one is for a seat on the PCC Board of Trustees. We have one applicant, Stephanie Williamson. What's the pleasure of the board?
Chairman, I'll make a motion to approve.
I have a motion from Commissioner Rose to appoint Ms. Williamson.
Second.
Second from Commissioner Ingram. All those in favor, let it be known by saying aye.
Aye.
All those opposed? Williamson's approved. All right, Planning Board. We have one seat and 3 applicants. That's Steve Harris, Billy Carden, and William Baldwin. Mr. Pleasure of the board.
Mr. Chairman,
Yep.
I move that we appoint William Baldwin to that post.
Have a motion from Commissioner Smith that we appoint William Baldwin to the planning board. Do I have a second?
Second.
Second.
Okay, we got a second from Commissioner Rose. All those in favor of appointing William Baldwin to the planning board, let it be known by saying aye. Let me tell you what,
Whoa.
we're gonna do a vote hands. Show of hands. This,
Sure. Mr. Chair,
yes, sir.
I'm just trying to see if we could have, since a motion was made, could we actually nominate another one because we do have three.
You never gave a chance for that. Yeah. You never, I mean, he made the nomination.
Well, he made a motion.
Okay.
If we've got a motion on the floor, we've got to act on the motion. If the motion fails, we'll open it back up. Am I correct, Mr. Attorney?
That's correct, Mr. Chairman.
Have a motion on the floor to appoint William Baldwin. Motion in a second. All those in favor of appointing William Baldwin to the planning board, raise your right hand. 1, 2, 3, 4, 5. Motion carries. Mr. Baldwin will be a new member of the will be a member of the planning board. All right. Updates, Madam Manager.
Yes, I would like to get a consensus from the board to agree to allow Chairman Yarrow to sign a letter of support for the PTRC grant application that I had discussed at our April meeting and have given updates since then in our progress that we're in. But one of the requirements is that we need a letter of support from the Board of Commissioners.
The manager's asking for board consensus that I be allowed to sign a letter in support of us applying for this grant. Is everybody okay with me signing off on that?
Absolutely.
All right.
DOT is working on all the requested information from the May 4th meeting, and we will compile in one email once complete so all commissioners can have the same update. And I also had Stephanie to send to Alvin Foster, since he is on the DOT with PTRC, about any request. I know they had reached out to the town as well and to Milton, and I just had her send the information, the questions that you all had about certain roads and things here in the county. I had her submit that as well, so he would have our information from the county. We will have a joint meeting on May 21st at Coast Square. Had a meeting with Small Town Soul website designer to start the process for updating our websites. Mr. Smith already, Commissioner Smith referenced that it's National EMS Week this week. Definitely would like to recognize all of our medics, EMTs, and anyone in the EMS field for the work that they put in, because I know it's a lot of dedication and they work a lot of holidays that others get to be home with their families, and they work a very different shift from the rest of our regular staff. So would like to thank them for the work that they do here in the county. I wanted to give a state budget update that was provided from the NCACC. I know that this just recently came out, I think it was May 15th, that most of the framework right now revolves around the state's income tax rate and government employee salaries, both of which have been a point of discussion between the Senate and House for over the past year. Both chambers agreed to a new personal income tax schedule with the rate set at 3.49% in 2027, then dropping every 3 years to finally end at 2.49% in 2035. Both chambers also agreed to place a constitutional amendment on the November the 2026 ballot that would cap the income tax rate at 3.5%. A similar constitutional amendment was passed in 2018 to cap the income tax rate at 7%. That provision was approved by 57% of voters. Teachers will see an average 8% raise, while law enforcement officers will see higher raises varying from 13 to 20% depending on the agency. Other state employees will see a 3% increase, and all government employees plus some local law enforcement officers will receive bonuses ranging from $500 to $1,750 depending on tenure and existing salary levels. The timing, there's still a significant amount of work to be done before both chambers agree to a joint budget, but both leaders have stated that they expect to have the work completed and the conference report ready for a vote by mid-June. So just wanted to provide you with that update. Our HR director, Crystal Stauffer, has put in a lot of work for our mental health awareness for the county employees. This is a 5-week mental health awareness campaign that was developed to promote awareness, reduce stigma, encourage healthy workplace habits, and strengthen a supportive organizational culture throughout the month of May. And our slogan is Stronger Together, Building a Culture of Mental Wellness. And the campaign is a weekly themes that are designed to engage both leadership and employees through educational materials, activities, and challenges. Week 1 was understanding mental health. Week 2, stress and burnout prevention. Week 3, support system and resources. Week 4, leadership and workplace culture. And week 5, self-care and sustainability. And based on leadership feedback, the following leadership commitment statement was developed. As leaders, we are committed to fostering a workplace culture where mental health is respected, supported, and prioritized. We will lead the empathy, encourage open communication, promote healthy work-life balance, and strive to create a safe and supportive environment where employees feel valued, heard, and empowered to seek support when needed. This campaign reflects the organization's continued commitment to employees' wellness, professional support, and building a healthier and more compassionate workplace culture for all employees. So I would just like to thank our HR director, Crystal Stauffer, for putting all that work in for our employees and for putting out there some information for mental health awareness. And my last update is the FY25 audit update. The bank recons are complete. Ms. Sharp says she just completed those over the weekend, and now she will work on doing a trial balance. And once that trial balance is complete, then the information will be sent to the auditors, and then they will begin to work on the financial statements.
Thank you. Mr. Attorney?
Thank you, Mr. Chairman. I have a brief update involving the civil case here in Caswell County Superior Court involving Runner Capital LLC versus Dongola Ventures, Christopher Hastings, and Vicky L. Hastings. And the county received multiple public records requests involving this lawsuit, as well as a subpoena request. And I found out late last Friday that the parties in this civil action have reached a settlement agreement, and a voluntary dismissal has been filed in this case. So we can go ahead and close this one out, and I'll have further updates for you in the closed session.
All right, thank you. Commissioner updates, comments. Let's see, Mr. Holt? Mr. Totten?
Nope.
Mr. Smith?
Yes, I have one thing for Melissa. Financially, 2026 was a net positive year cash flow with revenues exceeding expenses. So, the way the budget looks and that proposed budget looks like we had a terrible year. but actually we saved money this year. Instead, the problem goes back several years ago when the COVID money ran out. So it just now showing up now because we're getting caught up on our audits, and we know now that we were in trouble 2 or 3 years ago. So thank you so much for doing that.
Commissioner Rose?
Thank you, Mr. Chairman. Real briefly, like, thank everybody that did come out tonight. And there's a lot of people may know, some of them may not know, we're in the middle of budget. And I would encourage every citizen in this county to come out, to get involved, to hear what is going on. It's your tax dollars. You can come in and see what the county is facing. You can see the deficits, and you can see some of the decisions that we're going to have to make, and they're going to be some hard ones to make. But I would just encourage, the citizens to come out and listen. And, so many times that we've done budget, 2 or 3 people show up and nobody speaks. But yet when it's over, we're always a bad guy. That's all I have, Mr. Chairman. Thank you.
Mr. Ingram?
Nothing, sir.
Mr. Claggett?
Yes, I'd just like to remind everybody about Memorial Day this coming Monday.
Thank you. Madam Manager, I know your plate is running over with the budget, but once this budget is behind us, I want us to take a serious look at our county vehicle policy. Who's driving what, where they're being driven, why a vehicle is allowed to be driven outside of the county if it's not on official business. I know that some employees need to drive a vehicle home, but I'm not sure that as many as are being driven is serving our best interest. So once, the budget is done, so I'm thinking July, August timeframe, if we could kind of take a look at that and see where we're at. And if I hadn't already ticked everybody off, I probably will with my next comment. I know this budget has been tough. You and I have had numerous conversations over the last 6-8 weeks about things, and, a lot of it is our fault. We, as a board in whole, not everybody, chose to use money out of fund balance for every year I've been on the board. I voted for all 3 budgets, so hey, I'm as guilty as anybody. But some prior staff led us to believe that, hey, you're in good financial shape. You can do this. But now, as Mr. Smith has commented, these audits have shed light that we're not in the shape we thought we were in. And so this is the year of reckoning, so to speak. So gentlemen, if there are cuts that have to be made and you're not happy about them, please come to the table with a way to pay for them. If there are things in the budget that you don't want there, please be able to justify why you want it taken out. But this has been tough on Melissa. I know she has struggled with this one. This has been a hard budget for her and all the staff that's been working on it. And I thank them all, they've had a rough go of it for the last 2 months. But as I say, some of this was self-inflicted by us as a board. So, it's our mess. We got to fix it, and we will. We'll get through this. It ain't going to be pretty, as they say, but we will get through it. All right. Announcements and upcoming meetings. This Thursday from 11 to 1, the Library Health Wellness Fair at the Gun Memorial Library. Also this Thursday, the joint meeting between this board, the town of Yanceville, and Milton at Co Square. The county is hosting this time. Friday, May the 22nd, the community shred event at the Senior Center. Tuesday, tomorrow, May the 19th, Board of Adjustment meeting. Next Monday, the 25th, county offices be closed for Memorial Day. The 26th, the planning board will meet. June the 1st, Board of Commissioners meeting. Am I missing something on the 29th?
I know the recommended budget will be on the 27th
27th, I'm
at
sorry.
4 o'clock. And it'll be
27th.
a work session as well.
All right, 27th, recommended budget will be presented to the board for a work session, 4 o'clock here. All right. Closed session to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege as provided under North Carolina General Statute 143-318.11, subsection A3. Do I have a motion to go into closed session?
So move.
I have a motion from Commissioner Claggett,
Second.
second from Commissioner Rose. All those in favor, let it be known by saying aye.
Aye.
All those opposed. We now set in closed session.